The intensive care unit, or ICU, is a highly specialized area filled with advanced medical equipment, vital for supporting critically ill patients. Common devices include mechanical ventilators and patient monitors tracking heart rate, blood pressure, and oxygen levels. Infusion pumps deliver precise amounts of medications or fluids. Understanding and correctly using this equipment is fundamental for an ICU nurse, directly impacting patient outcomes. The nurse acts as a vigilant guardian, ensuring technology serves the patient effectively and safely.
Comprehensive training is the cornerstone of safe equipment handling in the ICU. This training should cover the theory of operation for each machine and include hands-on practice. Regular competency assessments ensure skills are maintained and updated.
Meticulous pre-use checks are mandatory before connecting equipment to a patient. This includes checking circuits for leaks and verifying alarm settings.
Adherence to device-specific guidelines is essential for safety.
Strict infection control protocols are non-negotiable. ICU patients are highly susceptible to infections. Each device has specific cleaning requirements. Good hand hygiene is crucial before and after touching equipment.
Proper training, checks, and infection control are vital for ICU safety. These practices ensure technology supports life and promotes healing.
Meticulous documentation is vital in managing ICU equipment. Every setting, change, and alarm response must be recorded.
Nurses often encounter problems first and need basic troubleshooting skills. Common issues include non-silencing alarms or occlusion errors. Quick resolution of minor issues prevents care delays. Nurses must know when to call for expert help.
Collaboration with biomedical engineers is crucial.
Emergency protocols must be clear and regularly practiced. Nurses must respond swiftly and effectively. For example, if a ventilator fails, manual ventilation is essential. Regular drills build confidence and ensure safety.
Effective documentation, troubleshooting, and emergency preparedness are essential for safe ICU equipment management.
Section 4. Professional responsibilities and continuous learning. Nurses have significant ethical responsibilities when using advanced medical equipment in the ICU. These devices sustain life, but they can also prolong suffering if not used judiciously. Nurses must advocate for their patients, ensuring technology aligns with the patient's wishes and best interests. They participate in discussions about treatment goals and help families understand the implications of life-sustaining treatments. Ethical dilemmas can arise, for example, regarding the withdrawal of ventilatory support. Nurses must navigate these situations with compassion, integrity, and respect for patient autonomy.
Legal responsibilities are also a major consideration for nurses handling ICU equipment. Incorrect use of a device or failure to respond appropriately to alarms can lead to patient harm and serious legal consequences. Therefore, adhering to established protocols and standards of care is essential. Accurate and thorough documentation provides a legal record of care. Understanding the legal implications reinforces the importance of proper training.
The field of medical technology is constantly evolving. Continuous education is critical for ICU nurses to keep their knowledge and skills current. This involves attending workshops, training sessions, and conferences. Hospitals have a responsibility to provide opportunities for ongoing education. Keeping abreast of new technologies ensures that nurses can use them safely and effectively. This dedication to learning defines a true professional.
Staying updated with training updates for existing equipment is just as important as learning about new devices. This commitment to continuous learning directly translates to improved patient safety and quality of care.
Section 5. The human element, communication and patient-centered care. The presence of complex medical equipment can be very intimidating for patients in the ICU. Nurses play a crucial role in addressing these psychological aspects. They can explain the purpose of each device in simple terms and reassure the patient that the machines are there to help them recover. Acknowledging their fears and providing emotional support can make a huge difference. The nurse's calm and confident demeanor around the equipment can also be very reassuring.
Effective communication with patients about the devices aiding their care is essential. Even if a patient is intubated and cannot speak, nurses should still explain what they are doing. For patients who can communicate, nurses should encourage questions and provide clear and honest answers. This empowers patients and helps them feel more in control of their situation.
Communicating with families is equally important. Family members are often distressed and overwhelmed by the ICU environment. Nurses should take the time to explain the purpose of key devices and provide regular updates. Answering their questions patiently and empathetically is crucial. This open communication helps families feel more involved and less helpless.
In conclusion, mastering ICU equipment is fundamental to providing safe and high-quality patient care. It involves comprehensive training, diligent safety checks, and strict adherence to protocols. This proficiency is a cornerstone of excellent critical care nursing.